Good morning, everyone. Mark Weeks here with the Florida Alcohol and Drug Abuse Association. We expect to get started on time in about 5 minutes. Good morning, everyone. I'm Mark Weeks, and on behalf of the Florida Alcohol and Drug Abuse Association, welcome to today's webinar entitled Patterns and Trends of Substance Use Within and Across the Regions of Florida, the annual update. This webinar is being made available through a collaboration of the Florida Department of Children and Families, Office of Substance Abuse and Mental Health, and the Florida Alcohol and Drug Abuse Association. Please note that as an attendee, you are in listen-only mode, and you will only be able to view your name. If you have questions, please send them to the presenter and me, the host, by using the Q&A panel. The button to open the panel is usually located on the upper right side of your monitor. Please use the Q&A panel to send any questions you think of them. The presenter will address them as time permits. Our audio is broadcast through the internet to your computer. If you are experiencing poor audio, there are a few options to try on screen right now, and these options are posted in the in-chat panel too. If you continue to experience poor audio through your computer, try rejoining the webinar and call in using the telephone I will call in option. You must be connected to the audio of this presentation and view it on screen as well to receive a certificate of attendance. The recording and materials used in today's presentation will be available on the FADA website within 30 business days. To access the recording, go to www.fada.org. Also, a PDF version of this PowerPoint presentation will be emailed to participants within that same time frame. FADA produces many webinars and workshops through the support of the Florida Department of Children and Families. To help participants track credits earned through attendance, we host an online community that provides personalized digital journal where participants can maintain statements of credit for webinars and workshops taken through the Florida Alcohol and Drug Abuse Association. At the end of today's webinar, the web browser will redirect everyone to an evaluation form on the FADA website. You will first need to register or sign in to your account to complete the evaluation. Information you provide to FADA as part of the registration remains confidential. Statements of credit will be posted within 30 business days after the evaluation closes in the individual personal development journals for persons completing the evaluation and attending the webinar in full. Completing the evaluation is necessary to receive CE credits or to access your statement of credit. Do note the evaluation will close at midnight on Friday, November the 22nd. 1 to 2 continuing education credits are available for participating in today's webinar for persons licensed through the Board of Nursing, the Board of Clinical Social Work, Marriage and Family Therapy, and Mental Health Counseling, and for those persons credentialed through the Florida Certification Board. If you are a licensed healthcare practitioner, be sure to include your Florida license number for reporting to CE Broker. When you register with our website for the first time, if you are certified with the Florida Certification Board or licensed outside the state of Florida, you do not need to provide your certification number when you register with our site. Note, please, that WebEx monitors arrival and departures of attendees and provides a report upon completion of this event. We are not permitted to provide contact hours or a certificate of attendance if you do not attend the entire webinar. We are not permitted to provide partial credit. And now I'd like to introduce Kelly K. Gurka. She is an assistant professor of epidemiology at the University of Florida. She earned her MPH at the University of Alabama at Birmingham, after which she served as a maternal and child health epidemiologist in the Atlanta Department of Public Health. Dr. Gurka then earned her PhD in epidemiology with an emphasis on injury prevention and control at the University of North Carolina at Chapel Hill. She was the recipient of the 2007 Susan P. Baker Student Paper Prize. And now I will hand the presentation over to her. And when you're ready, Kelly.
Good morning.
I hand it over to you.
Mark, can you hear me?
Yes, we are good to go.
All right, excellent. Good morning, everyone. This morning I'm going to present on the patterns of and trends in substance use in Florida. This is an update to the report that was released earlier this year in April. And you can find a copy of this report on the FADA website for your reference. So there are a couple of learning objectives that you should be able to, participants are expected to be able to do these three things at the end of this presentation. So the first learning objective is to characterize the decline in overall substance-related mortality occurring in Florida in the first half of 2018. Differentiate between substances that were involved in a larger number of deaths in 2018 than 2017 and those that were involved in a smaller number of deaths in 2018 than 2017. And finally, to identify the new drug that is now included in substance-related surveillance conducted by the Medical Examiners Commission, as well as the new substance that districts began reporting in 2018, though it won't be required until 2020. And we'll talk about that later in the presentation. So this webinar is based on the report that was a brief update to the 2019 annual report, Patterns and Trends of Substance Use Within and Across the Regions of Florida. This particular update is based on data that have been released since the preparation of that 2019 annual report. Additional data, however, became available after the data for this update were compiled. The most notable example is the Florida Youth Substance Abuse Survey. Those data have been released after the data were compiled for this update, and those will be included in the 2020 annual report as a result. In addition, any state-specific data that become available from national surveillance efforts between now and the preparation of the data for the next annual update will be included. And if you're interested in the results of the Florida Youth Substance Abuse Survey, you can go to the FADA website, and under their research section, you can find access to that report as well. So what are the data sources that we use to compile this update? So first, we use data from the National Survey on Drug Use and Health. This particular data source is sponsored by the Substance Abuse and Mental Health Services Administration within the federal government. This data is conducted annually at the national level, and then periodically state estimates are released. But we were able to use these data to update some of the national estimates in the data graphs that you will see throughout this presentation. In addition, we use data from the Behavioral Risk Factor Surveillance System. This surveillance system is sponsored by the Centers for Disease Control and Prevention, and it is also conducted at the national level annually. We utilize the drugs identified in deceased persons by Florida Medical Examiners, their 2018 interim report. So this report is prepared twice a year. There's the annual reports and the interim reports that comprise 6 months of the year's data. And it's prepared by the Florida Medical Examiners Commission based on the reports that all of those regional MEs send to the state. And this particular interim report that we use to update the trends over time included data from the period of January to June of 2018. We also use the Florida Estimates of Population 2018 estimates published by the Bureau of Economic and Business Research at the University of Florida. Let's talk a minute about the managing entity regions within the state of Florida. So if you look on the right-hand side of this slide, we have the state of Florida with the counties denoted. In addition, typical geographic regions that are utilized to describe the state. However, for substance abuse purposes, we divide the state up into the regions by managing entity. And so those are depicted here. So for example, in this blue color, we have the Big Bend Community-Based Care Incorporated region. And these are the counties that are served by BBCBC. And then we have the state population over here on the left divided up by these managing entity regions. So you can see that the panhandle of Florida comprises about 7% of the state's population. And so when we do, most of the data for this report are not available at the county level, or we're not divided up in that way. There are occasions in which we will present the data by managing entity region. And so these are those regions to which I'll be referring. Here we have the Lutheran Services Florida depicted in yellow. the Central Florida CARES health system depicted in this orange color. We have the Southeast Florida Behavioral Health Network depicted in this salmon color. Central Florida Behavioral Health Network depicted in this mauve color, and then this kind of peachy color at the bottom is South Florida Behavioral Health Network. And note that Broward is its own region served by the Broward Behavioral Health Coalition. And you can see how the population is not evenly distributed amongst these regions. And so most of the data that are presented in this webinar are counts, so keep that in mind in terms of thinking about where the population density in the state is. Here is another slide that describes those managing entity regions a little bit further with the composition by number of counties and where the managing entity region is located in the state. And I will reference these abbreviations later on in the presentation. So let's get started talking about the trends that we've seen related to various substances. And the first substance we're going to talk about today is alcohol. And alcohol is reported both for youth and then adults 18 years and older. So nationally, for underage drinking, the general trend is that there's been a decline in the use of alcohol over time among 12 to 17-year-olds, and that is continuing. We've seen a slight increase in alcohol use among adolescents in Florida that increase mimicked that of the nation as a whole in 2017, and I will show you that on the next slide where we have the data graphed for you. Without the latest data, it's unknown whether Florida youth experienced the same decline in current underage drinking as American youth overall. That was based on the data that we had compiled for this report. I'll show you a little bit of an update based on the Florida Youth Substance Abuse Survey in just a moment. So this is the prevalence of past 30-day alcohol use among adolescents aged 20 to 17 years in both Florida and the United States from 2006 to 2018. And one of the things that I want to point out about the NSDA data, these again are the National Survey on Drug Use and Health, they query 12 to 17-year-olds, whereas the Florida Youth Substance Abuse Survey divides youth up into middle school aged children and high school aged children. So keep that in mind when we're looking at these trends over time, that crosses those two age groups that we look at specifically here in Florida. So if you look at the Florida trend line here, you'll see that overall, over the last decade plus, that generally alcohol use among underage drinkers has decreased. And then for the nation, that's also been on a downward trend as well. So in addition to just the prevalence of any underage drinking, we're interested about underage binge drinking because this is a problematic behavior that often leads to additional issues down the road, such as alcohol use disorder. Patterns observed for current drinking were also observed for binge drinking. The prevalence continues to decline over time. And the prevalence in Florida actually tracks very closely with that of the nation, though we saw a slight increase in the last available state-specific data. And again, this is based on that NSDA source. Without the latest data from NSDA, it's unknown whether Florida youth experienced the same decline in binge drinking as defined in this survey as American youth overall. So here we have those numbers in this graph. And here we show the prevalence of binge drinking among adolescents, again, aged 12 to 17 years in Florida and the U.S. overall. And if you look at these trend lines over time for a little over a decade, you'll see that they're generally decreasing, both in Florida as well as in the United States overall. We had a slight increase from the 2015-2016 average rate to 2016-2017 average rate, but very slight. And if you look at the trend overall, it's downward for the state and still tracking very closely with the nation. So Florida youth alcohol use. Based on the newly released data from the Florida Youth Substance Abuse Survey, and this survey is conducted among school-age adolescents, middle school and high school-age adolescents in the spring. So these data are very recently released. Fewer Florida high school students endorse current underage drinking. So they're asked if they've used in the past 30 days, and binge drinking than in 2018. So both of these numbers, the decline in current alcohol use and the decline in binge drinking, have been consistent since 2004 for alcohol use and since 2006 for binge drinking. However, there was a cause for concern in these data because more Florida middle school students endorsed both current underage drinking and binge drinking. And these were the first increases that we've seen since quite a while ago, including 2004 for the current alcohol use and since 2010 in binge drinking. So we look forward to seeing those NSDA data to see if they confirm the findings of the Florida Youth Substance Abuse Survey, and we'll look to see over time whether these trends continue or if this was just a slight increase that we'll see decline again next year. So moving on from alcohol use among among youth, let's talk about alcohol use among adults. So the prevalence of alcohol use among adults has remained largely unchanged over time. And the prevalence, again, for adult Floridians tracks very closely with the national prevalence. So I'll show you those data for past 30-day alcohol use among adults. And you can see for both Florida and the nation, the prevalence of current alcohol use is right somewhere between 50 and 60% for both the state and the nation. The rates have converged a couple of times and crossed, but they're very, very similar and really not increasing or decreasing over time. Binge drinking among adults, as I mentioned a few minutes ago, it's used as an indicator of problematic drinking among youth, but also among adults. And it tracks among Floridians a little bit lower than the nation as a whole. That being said, the changes over time in the national prevalence are also reflected in Florida. So the trend over time is very similar. In the last year, however, the prevalence nearly converges because, as you'll see in this next slide, that though the rate has been lower in Florida consistently over the last decade plus, we've seen a slight increase recently in the state of Florida. At the same time, the nation experienced a decline. So we'll need to watch these rates very closely to see what those look like moving forward in the state of Florida compared to the nation. But if you look at these rates overall, again, very little change over time in this particular indicator. And these data are from the Behavioral Risk Factor Surveillance Survey. So a slightly different survey method than either the Florida Youth Substance Abuse Survey or the National Survey on Drug Use and Health. So in terms of the overall trends in alcohol, the current trends that we've seen continue based on updates to the national data. The prevalence of current alcohol use and binge drinking among adolescents continues to decline, although we did see that little bit of increase among middle schoolers in the most recent Florida-specific survey that's caused for a bit of concern and keeping an eye on those trends. And then the prevalence of current alcohol use and binge drinking among adults has really remained largely unchanged over time. Now we'll move from alcohol to tobacco and nicotine. So tobacco use of any kind is a preventable cause of not only a number of diseases, but also deaths. However, as conventional tobacco product use declines, the use of nicotine-containing products is on the rise. At the time data were compiled for this updated report, Florida-specific updates to adolescent use data were not yet available. Let's dig into some of the data. So when we're talking about combustible cigarette smoking, at the time the data were compiled for this report, Florida-specific updates to adolescent use data were not yet available. Again, if you'd like to look at some of the Florida trends, you can access that other report. Adolescent use of cigarettes continues to decline markedly over time. We'll show you that in the next graph. Compared to adolescents, cigarette smoking is more prevalent among adults in both Florida and the U.S., and adult use of cigarettes is trending downward, but at a much slower rate. So here is past 30-day use of conventional cigarettes among youth aged 12 to 17 years. These data are based on the NSDA, and you can see here that there's been a significant decline over time in the nation as a whole of current cigarette use among youth. That same exact trend at a slightly lower prevalence has been observed in the state of Florida as well. And for this particular survey, we don't yet have state-specific data. Those will be out here. As you can see, overall, the trend is downward. Whereas among adults in Florida and the nation as a whole, we're seeing much steadier rates of cigarette smoking, current cigarette smoking. So the Florida rates track very closely with the national prevalence, crossing, nearly converging a couple of times, but largely remaining just below that national prevalence. And these data are based on the behavioral risk factors surveillance system. So now we're going to turn to e-cigarettes. So this is the replacement of those conventional tobacco products with some of those nicotine-containing products. And adolescent use is on the rise, while adult use is on the decline, according to the most recent data, which is fairly limited. So lifetime and past 30-day use of e-cigarettes by sex and school level in Florida for 2016 and 2018. So these are those newly released data from the Florida Youth Substance Abuse Survey. We show here lifetime endorsement of e-cigarette use, past 30-day use, so the youth currently using. We have these data separated by sex and then by age group, so middle school students versus high school students. And you can see the prevalence of lifetime use has increased, as well as the prevalence of current use has increased. And this is across both boys and girls, and was observed in both middle school and high school. So this is a cause for concern. There's also a concurrent outbreak currently of illnesses and deaths associated with e-cigarette use. However, when we look at the prevalence of vaping among adults 18 years of age and older in Florida and the U.S., the data paint a different picture. So these are data from the Behavioral Risk Factor Surveillance System. We have the rate of e-cigarette use, so the prevalence here, lifetime, and then current past 30-day use. And the orange lines are for the nation. And then the Florida lines are the blue. Lifetime use is up here, and then past 30-day use. And you can see all four of these numbers declined in this 1 year time interval. This doesn't tell us a lot of information with just the 2 years of data, other than we do see a downward trend that seems to be fairly consistent. These decreases are fairly modest, however, so we'll need to watch these numbers over time. So what are some of the summary points about tobacco and nicotine in the update report? Continue to make progress in the prevention or cessation of conventional tobacco products. However, vaping poses a new risk, and we're seeing the prevalence of these nicotine-containing products, the prevalence of their use is increasing. And though nicotine-containing products were designed, at least in part, as an alternative to tobacco products, use of these products is lower in Florida among adults than among adolescents, which is a cause for concern. And most of those adolescents are likely nicotine naive at initiation, especially with the significantly decreasing rates of lifetime tobacco use. So now we'll switch from tobacco and nicotine-containing products to marijuana. Updates to the Florida-specific data for youth were not available at the time the data were compiled for this report. So we don't have updates included in this webinar or the update report. Nationally, new data suggests that the prevalence of marijuana use among both adolescents and adults continues to rise. And these increases may be a harbinger for such an increase in Florida, given the prevalence of marijuana use in Florida was already outpacing that of the nation. So in this graph, using data from NSDA, we present the prevalence of past 30-day marijuana use among adolescents aged 12 to 17 years. And these data are for both Florida and the U.S. as a whole from 2006 to 2018. And you can see the use is not changing a lot, but if you look, we had a little bit of a decrease perhaps in Florida through the late first decade of the 2000s, and then we're seeing a bit of an increase in the last three two-year averages of these prevalence rates. And you see in the U.S. a similar increase for 2016, 2017, 2018. And you'll notice here that the rate among Florida adolescents began before that among the nation. And so that's a cause for concern if we're continuing to see these numbers rise, that we'll likely see that among Florida youth. American adults are also increasingly using marijuana. So adult Floridians lagged just behind the nation with regard to prevalence of current use of marijuana. Increases in Florida appeared to begin accelerating in about 2016-2017, perhaps in anticipation of or response to legislation passed in 2016 and enacted in 2017 related to the medical use of marijuana. So in this graph, the trend is a bit clearer among adults, I think, than among adolescents. In the nation, you've seen a fairly steady increase over time since 2006, and you've seen that same increase in Florida. Now, you'll note that among adults in Florida, the prevalence is lower than that of the nation, but tracking very, very closely in terms of the trend. And you'll notice in the last several years, about 2015 to 2018, that the increase seems to have, after a slight leveling off, accelerated. And we're seeing a similar trend here in the Florida numbers as well.
Kelly, our break was scheduled for slide 27, and we have reached that. So we're going to go ahead and take the break a bit early in terms of time. We'll take a 5-minute break, and we'll return at 10:33. And Kelly, also I sent you a message too, if you would take a look at that in the in-chat panel. And we'll return at 10:33. Thank you all. All right, everybody. This is the end of intermission. At this time, I'd like you guys to go ahead and think of some questions you may have, and go ahead and send them through the QA as I turn the presenter role back over to Kelly.
Okay, making sure everyone can hear me.
Yeah, you're a little soft.
Okay. I thought we would start off by taking any questions that people have on the content that we've covered so far in terms of alcohol, tobacco, nicotine-containing products, and marijuana. If anyone has any questions, go ahead and type those in now, and I can answer.
Kelly, I'm not getting any questions in, so we can proceed.
Okay, great. Thank you. So now we will turn from the more readily available substances in alcohol, tobacco, and marijuana to more difficult, perhaps, to obtain substances.
Hold on for just a moment. We are not. All right. Try to hit the option down again.
Okay.
Try to switch slides again. I don't know why I switched that slide.
Yeah, I was able to go up.
Yeah, it's going through my. Oh, you know what? Hold on. I apologize for this. All right, try to move that slide down again.
Okay. Don't seem to be able. Oh, there we go.
There it is. Perfect. All right. Sometimes WebEx's a little funny.
All right. So as I was saying, we'll turn our attention from the perhaps more readily available substances to novel psychoactive substances and some of the other prescription and illicit substances. So first, let's talk about these novel psychoactive substances. So the proliferation of new synthetic drugs, collectively known as novel psychoactive substances, pose a particular public health challenge. So as people develop more and more new substances, they become more difficult to test for, more difficult to track. And so we are constantly having to respond to these emerging threats, which is where some of that challenge lies. And then 3 of the 4 reported in the April 2019 annual report are included in the interim report of the Medical Examiners Commission, but only one of those saw an increase from the first half of 2017 to 2018, and that was synthetic cathinone, with 122 deaths involving this drug. And you will note that only 122 deaths is not a very large number for a state like Florida with a population estimated to be over 20 million. But because of the nature of these drugs, we still track these to see what's going on with these novel substances. And so of these 122 deaths, though it is a relatively small number, as I just mentioned, nearly 3 of every 5 decedents in whom this particular drug was detected died as a result of the synthetic cathinone poisoning. So it's important to note for all of these medical examiner data that we have been reporting that the drug may be present in the decedent and have contributed to or been involved in the death, but not been classified as the cause of that death. or the drug could be listed as the primary cause of death. And many of the substance-related poisonings that we see, the fatal poisonings, there's polysubstance use that has occurred. And so many of these deaths are not mutually exclusive because they may involve other drugs as well, but they just were not the cause. So you'll notice as I go through reporting on these data that we both do present in the toxicology report during the death investigation versus the actual cause of that death. Okay, I'm going to take just a minute to pause on this topic because we did get a couple of questions. So the first question is, with legalization of cannabis, any thoughts on how a drug counseling treatment center should treat, monitor a person that is court-ordered to complete a substance use counseling program for cannabis, but then the person gets a prescription for medical marijuana? I think this is a particular challenge and not terribly dissimilar from people, for example, who are diagnosed with an alcohol use disorder. I am not a clinician, so given my epidemiologic background, I am much more comfortable with talking about the data itself. So I would refer you to other resources in terms of how best to handle that piece of it. And since the medical marijuana could also come back as a positive drug test. Yes, I think this is a particular challenge. This is also true for opioids and any other substance that that is either legally available or by prescription. And when we have medical care, particularly among mental health providers and other segments of the healthcare system, it's a challenge because we don't always have good communication between the two. So I will go back to the novel psychoactive substances in terms of trends in that area. So now we're going to talk about opioids a little bit. So first half of 2018 saw another subsequent year of an increase in fatal prescription opioid overdoses, with 216 cases occurring in the first half of 2018 compared to the first half of 2017. And you'll recall that I mentioned the Medical Examiners Commission releases 2 reports every year. One is the interim and one is the annual. And so for these data, we have just compared to the first half of 2017 because that's all of the data that are available for 2018 to see if we have experienced a year-over-year increase. I'll also note here that prescription opioid overdoses includes fentanyl. And we'll make a comment about that in a little bit about why we might be seeing that increase after we go through some of these data. So number and percent of deaths involving prescription opioids among all deaths involving substances in Florida, January through June of 2013-2018. So again, this is from the interim reports called the Drugs Identified in Deceased Persons by Florida Medical Examiners. These reports are put out by the Florida Medical Examiners Commission, and you can access all of these data on their website, and there are links in the annual update on the FATA website to these data sources as well. If you'll notice on this graph, again, keeping in mind that these are all interim reports, so this is January to June for each of these years. And so we have the number of deaths that occurred over time. Excuse me. And although Florida did experience some declines previous to this, following the pill mill laws, we have seen a steady increase in the last several years in the state with deaths involving opioids. And you'll notice that here we have deaths with the drug detected and then deaths caused by the drug. And this is the percent. So notice the 2 different axes here. We have the number over here, and then what percent of deaths were caused by this drug specifically. So again, increasing involvement of, shouldn't say involvement, but you will notice that the deaths that involved opioids are increasingly attributable to those opioids over this period of time, up to 75%. Which is a cause for concern and probably linked to the potency of the drug itself. So prescription opioids, again, the number of deaths involving most types of prescription opioids declined in the first half of 2018 compared to the first half of 2017. There were a few exceptions to those, including hydromorphone and buprenorphine, and most notably fentanyl. So we'll take a look at this graph. This graph is fairly busy, so I'll walk you through it. So we have up here, this blue line is morphine, and it is often difficult to detect the difference between morphine and then heroin because the metabolites are the same at the end of this process, and so this number may be influenced not just by medical morphine or prescription morphine, but also heroin. Then you'll see here, if you look at this orange line, fentanyl, which was one of the drugs that saw an increase in 2018, so you did have a decrease here in the morphine. And then you have fentanyl is this nice orange line here, and it is increasing markedly over time. So we saw huge increase, a modest increase 13 to 14, and then the increases accelerated with a brief respite from 2016 to 2017, and then another huge increase from 2017 to 2018. Everything else prescription-wise, except for hydromorphone, went down. So you'll notice oxycodone is down. That's here. This blue line is hydrocodone. And you'll notice that this orange dotted line is hydromorphone. And if you look at it over time, it's pretty steady with, it has increased slightly from 2014 to 2018, but fairly modest increases compared to that of fentanyl. Then we have oxymorphone has decreased. Tramadol has been pretty steady in the last year. A little bit of an increase, then some decreases, followed by a leveling off. Then we have buprenorphine here, which was not involved in very many deaths early in this period that we're looking at, but they've increased steadily over time. And that may be attributed to increased access through expansion of treatment programs, whether that's being diverted or among patients who are in treatment would be an interesting thing to look into a bit more deeply. All right, so let's go back to the previous slide for just a moment. And this is the point that I wanted to make about fentanyl. So though it is available by prescription, it is likely that many cases involving fentanyl are due to illicit fentanyl rather than misuse of prescription fentanyl. So this is fentanyl that is manufactured in clandestine labs and then sold illicitly as opposed to prescription fentanyl. And the increase that we see in fatal prescription opioids is driven nearly entirely by the fentanyl-caused deaths. So if we go back down to this graph, again, we talked about how the only two other drugs where we saw an increase is buprenorphine and then hydromorphone, but both of those are very modest increases compared to what you see here in fentanyl. And this is important to point out because we are making strides in terms of most prescription opioids, and the prevention strategies that we use to prevent misuse of prescription opioids are going to look very different from those that are going to be effective against something like illicit fentanyl. All right, so fentanyl analogs, after significant increases from 2016 to 2017, the number of decedents in whom fentanyl analogs was detected declined in 2018. So fentanyl analogs are the drugs such as that are used to detect use of drugs such as carfentanil. So they're slightly different than the synthetic fentanyl that we were talking about in the previous slide. So again, the source for these data is the Florida Medical Examiners Commission. And in this graph, we present the number of decedents in whom fentanyl analogs were detected and caused death in Florida from January to June. And this is 3 years of data, as you can see. So 2016, 2017, 2018 are depicted in this graph. You'll notice over here, these are the number of deaths in which the fentanyl analogs were detected. Seeing a spike here in 2017, and then these were the number of deaths in which fentanyl analogs were ruled to be the cause of death. If you compare some of the numbers between the left side of the graph and the right side of the graph, you'll notice that there's not a lot of difference between the incidence of both, so 183 versus 149. And this suggests that these drugs are particularly dangerous because they comprise the vast majority of deaths involving these drugs were actually caused by these drugs. The good news is that in the latest year for which we have data, or the latest half a year for which we have data, we've seen significant decreases. So yes, someone just asked, do you think that the Suboxone or buprenorphine might not be the sole reason of death and may be attributed to polysubstance use of that and an opioid? I see that as an increase in death or severe illness at my center, mostly use of both causing fatality. And then it looks like your question got cut off a little bit. And I think that is probably the case. And so thinking about, we have increased access to medication-assisted treatment using buprenorphine. However, if you have a patient who is engaged in treatment, perhaps an outpatient center where they're going and they're getting buprenorphine prescriptions periodically and using those to assist them in recovery, and then for some reason this patient relapses, perhaps they're using the buprenorphine with some other drugs. And I don't have again, these data are all mutually exclusive for each of these drugs is presented by itself, but it doesn't necessarily tell you what other substances were involved. Now here we can see that there had to have been polysubstance use in several of these because we have deaths for which fentanyl was detected, these analogs, but it wasn't the cause of death. And we know that most of these deaths involve polysubstance use. And it may be that the medical examiners ruled the buprenorphine to be the primary cause, but it was potentially wouldn't have occurred had those other substances not been involved. So for example, if you have an opioid overdose in which alcohol is involved, the concentration of opioids that needs to be present is going to be lower in the presence of alcohol than it would be on its own. And so that makes a lot of these, it's much more complicated, as you're pointing out, than just that single drug was involved in the death. Okay. Oh, Mark, it seems that I do not. Oh, I'm in the chat. That's what I'm switching between comments as opposed to questions as opposed to slides.
Yeah, I see. It can be a hassle sometimes. I do want to mention to our users that the Q&A and chat panel have a limit of 250 characters. So when you're typing out your questions, just acknowledge that.
Okay. So now we'll switch gears slightly from, we switched gears with the fentanyl analogs, which could be legitimate or clandestine, but here we're going to move on to opioids. So this, when heroin is always illicit. So after 4 years of precipitous increases in the number of deaths involving heroin, fewer of these deaths occurred in the first half of 2018 compared to the first half of 2017. So I'll show you these data. So we're making some headway in this particular area. So you'll notice that, again, steady increases, and let me orient you to the graph. So this is, again, all these data are from the Florida Medical Examiners Commission, and we have on the y-axis here the number of deaths. So back in 2013, we had a fairly small number of deaths with heroin or due to heroin. And again, this is heroin was present versus heroin was caused by, or death was caused by heroin. And this is precipitously increased until last year, and we've seen an increase in the first, we have seen a decrease in the first 6 months of 2018 compared to the first 6 months of 2017. And so it may be due to some of the prevention strategies that we're all working so hard to implement, increases in people having access to treatment, but also it may be changes in the supply. So those are the other kinds of bigger picture data that would be useful in looking at in connection with these to see what might be going on in terms of why we would be seeing these decreases. So then I just wanted to draw your attention to a couple of new drugs that the Florida Medical Examiners Commission has begun to track. So beginning with this latest interim report from 2018, we start getting reports on U47700. It's also known as U4. It's a highly potent synthetic opioid, so similar to something like synthetic fentanyl. And it was included in the drugs identified in deceased persons by Florida Medical Examiners 2018 interim report. It's also known as pink or pinky because sometimes, although it is a white powder, it may have a pink hue to it, so that's where it gets that colloquial or street name from. And there were 33 occurrences of deaths that involved this particular drug in January to June of 2018. And again, this has been one of the challenges in the opioid epidemic and is true for the novel psychoactives as well. Keeping up with these drug trends can be challenging because the surveillance system has to keep up with newly evolving substances that our current testing may not be able to quantify or even qualify that they're present in these death investigations. And so when we have these newly emerging substances, that's why you'll see changes in the surveillance and what's being reported. So another new opioid or opioid-like substance that's being reported in this year's report is kratom. And it wasn't specifically requested by the Medical Examiners Commission for 2018. However, many districts began reporting deaths that involved mitragynine, which is also known as kratom, that's the more colloquial term, this year. And reporting of mitragynine will begin for all districts by 2020. And in this first reporting period, again, remembering that not all the districts reported, there were 40 occurrences. And so kratom is of growing concern because of its availability, and it's often used by people who use substances, opioids in particular, as a substitute or maybe a way in which to handle withdrawal symptoms. But it appears that its presence is of concern as we move forward, and we'll be tracking this much more closely in the state of Florida as we move forward. So I'll go ahead and stop there just briefly and see if we have any more questions related specifically to opioids. So there is discussion about kratom and how it's scheduled. Now, so one of the participants said in the question and answers that they have seen kratom sold in stores, and will someone be making this illegal? So this is a botanical, and there has been, increasing discussions about where it should be scheduled. So Health and Human Services sent a letter to the DEA saying that these should be classified as Schedule I substances. And I am not precisely sure of where that is. I think the regulations are on hold, but that is something that's been discussed. So does U4 show up on drug tests under opioid and or fentanyl? I know general drug tests Kratom has not. So part of it is depending on what the panel that you're running is, if it includes some of these very specific drugs, and there's a lot of investment that has to be made at the state and or local levels in terms of being able to do some of these toxicology tests. And so that varies in terms of which tests you have. And then it varies from state to state as well in terms of which fentanyl analogs, for example, specifically are being tested in your toxicology panel when the death investigation is conducted. So I hope that answered the question related to U4 and Kratom in drug testing. So someone asked, what are your thoughts on Suboxone being used in conjunction with heroin at different times and to alleviate withdrawal symptoms? Is it dangerous given it has a street value? This question is getting a little bit beyond the epidemiology of buprenorphine. I think it's like any other prescription opioid, that it has an appropriate medical use when used correctly and appropriately as prescribed by your physician. But diversion is certainly a problem with buprenorphine as well. From my own personal perspective, I think that buprenorphine does have some value, and it may be perhaps among people who cannot otherwise get access to medication-assisted treatment. But those are my own opinions. And so in terms of all of the prescription opioids, we know that they have been diverted in the past, and a lot of the prevention strategies and interventions that have been implemented in the past several years, particularly on the public health side of things, such as use of prescription drug monitoring programs, are aimed at trying to prevent diversion. So if you think about people who are using substances versus opioid-naive populations, there's going to be a difference in the way those interventions might impact those populations. And so if you're targeting prevention strategies where you're giving physicians and other people who have the authority to prescribe opioids more information through the PDMP, the goal is to prevent inappropriate use, as opposed to among a population that the substance abuse community is often serving, is to mitigate the harm associated with that and try to get people treatment for substance use disorders. And so I'm not sure that that answers your question, but certainly we'll see that none of these substances is without risk because we're having this conversation. And with the increase in buprenorphine showing up in, the increase in deaths in which buprenorphine was detected, a further investigation into those specific cases is warranted to understand, where was that buprenorphine obtained, how was it used, and have that information inform prevention strategies. Yes, so all of these data, so we had another question, the 40 deaths from Kratom were Florida, correct? And that's true. All of these data that I am presenting that are deaths are specific to the state of Florida. So I have not presented any national data related to fatal poisonings substances. And if you'll recall, going back to our learning objectives, the third learning objective was about what newly emerging drugs are now being included in the Medical Examiners Commission reports, and it's these two that we've just talked about. So the U4 that we talked about in the previous slide, and then Kratom that we've talked about in this particular slide. And mitragynine is the substance that's tested for in Kratom to detect it. Okay. So if we don't have any more opioid-specific questions. And if an opioid question comes up for you as we move through the presentation, I'll take questions on any of the substances about which we've talked at the end of the presentation as well. But I'll also stop as we make our way through the next couple of substances like I did for this one to allow you all the opportunity to ask questions. Okay, moving on to cocaine. So after 4 years of increases in the number of deaths involving cocaine, fewer of these deaths occurred in the first half of 2018 compared to the first half of 2017. So these are those data. So let me walk you through this graph first. Again, these data are from the 2013 through 2018 interim reports from the Florida Medical Examiners Commission. On the left axis here, you will notice that we have the number of cases. On the right axis, we have the percent. So if you look in this legend up here, we have the number of deaths in which cocaine was detected, the number of deaths for which cocaine was deemed the cause, and then of these total deaths, what percentage of them were attributed to cocaine. So in 2013, for example, you had 668 decedents in whom cocaine was detected, and of those 668, 200 cases were deemed to be attributable to the cocaine. You can see that these numbers have steadily increased over time from 2013 through 2017, more than doubling in that 5-year period. And as the number of cases increased, so did those involving cocaine that were attributable to cocaine, and that peaked in the first half of 2017 at 65%. We saw a decrease in the first half of 2018 from 1,584 deaths that had involved cocaine to 1,469, and then we saw a similar decrease in the number of deaths that were caused by cocaine from 1,029 in 2017 to 844 in 2018. And the other notable thing is that not only did the numbers overall decrease, but also the percentage of deaths in which cocaine was present that were deemed to be caused by cocaine declined. So again, significant amount of polysubstance use here, but these deaths increasingly in the first half of 2018 were caused by some other. And the number of deaths involving cocaine differ by managing entity region, though the general trend statewide has been an increasing number of deaths occurring over time until this year. So here we have the managing entity regions depicted on this graph. And if your region is up here in which you work, you probably know what the acronym means, but I'll walk you through these just to remind you. So we have the BBCBC, which is the Big Bend Community-Based Care, and that is over in the Panhandle. So those rates are depicted in yellow. And you'll notice that these rates were pretty steady for a couple of years and then saw that same market increase that we observed across the entire state with the same decrease in the first half of 2018. That same trend was observed in Lutheran Services Florida region, so that's kind of north central Florida, and also in the Central Florida Behavioral Health Network. Same pattern, either steady or slow increase 2013 to 2015, an acceleration in the increase through 2017. And you'll notice here that the decrease is a little bit smaller, but still a decline. Whereas if you look at the Central Florida CARES health system, so that's also in Central Florida, this region continued to see an increase. And aside from the Southeast, Southeast Florida Behavioral Health Network, which is over on the west coast of Florida, including Tampa and Sarasota, down just north of Monroe County, they saw a slight increase as well. And so for the state overall, the trends in the early half of 2018 look good with regard to cocaine use and its involvement in death, but those same trends are not observed equally across the managing entity regions of the state. So I will talk about methamphetamine next, and perhaps we'll go through these data as well, and then we can ask questions about stimulants in general. So there were no new data regarding the use among youth when the data were compiled for this update. The number of deaths involving and attributed to methamphetamine continued to increase in Florida in 2018, with an increasing proportion of deaths involving methamphetamine being attributed to the drug. We'll look at those data. So the number of deaths, and remember, this is for all age groups. So the number of deaths with methamphetamine detected and the number in percent of deaths attributed to methamphetamine in Florida. So this graph, I'll walk you through it first, looks just like the one from cocaine in terms of the structure of the graph. So again, these data are for those interim reports from the Medical Examiners Commission. We have number of cases over here, the blue being the number of deaths in which methamphetamine was detected, and the orange being the number of deaths that were attributed to methamphetamine. And then again, up here we have on this y-axis the percentage of deaths that were caused by methamphetamine. And, you know, a little decrease and increase and pretty steady for a little while, but then we've seen a steady increase over the last 2 years, January through June periods that we have, for which we have data. And these numbers, both the number of deaths in which methamphetamine was present, as well as the number of deaths caused by methamphetamine and the percentage of deaths that are attributed to methamphetamine, all on the rise, particularly from 2017 to 2018. So if you take the whole stimulant picture as one, with the exception of some modest slowing in the number of deaths due to cocaine in the latest reporting period for which we have data, deaths involving and attributed to stimulants continue to be a growing public health concern. And there has been some discussion at the federal level that we started off with a prescription drug epidemic, prescription opioid, epidemic, that then transitioned into a heroin epidemic that then transitioned into the third wave, which would be the fentanyl epidemic, and that perhaps we're beginning to see the emergence of a fourth wave epidemic in terms of stimulants. And so this is really concerning over time. Again, we see perhaps some modest improvement in cocaine because we see some of these decreases, though they're not, here we go, some modest decreases, though they're not observed equally across the state of Florida. But when you take the methamphetamine and the cocaine numbers as a whole, stimulants continue to be rising. So I'll stop there with the stimulants and see if there are any questions to entertain related to cocaine and methamphetamine. Right, it does not appear that we currently have any questions about stimulants. So now I'll switch gears to talking about benzodiazepines. So the number of deaths in which benzodiazepines were involved has decreased, and a smaller percentage of deaths involving benzodiazepines were ruled to be caused by these drugs. Let's dig into the data a bit. So this graph is structured similarly to the previous two that we observed. So here we have the number of deaths across the state that involved benzodiazepines, meaning that benzodiazepines were detected in the death investigation. And then a much smaller number of these were caused by death. much smaller number of these were caused by benzodiazepines. And so if you look at these percentages, 25, really kind of the low point has been in 2018 at about 24% with a high point of 27%. So these substances in particular are commonly used in conjunction with other drugs, as you know from treating patients in this population that have substance use disorders. And oftentimes, as I stated earlier, fatal poisonings often involve multiple drugs. And when these drugs, such as alcohol or benzodiazepines, are present with other drugs, such as opioids, they can decrease the concentration of opioid that needs to be present in order for it to cause a fatality. And so that's why these are of particular concern, as many of you know. And the other thing about benzodiazepines is because they are a prescription drug that have a medical use, we're back at trying to figure out what is non-medical, extra-medical use, inappropriate use versus when is it being used appropriately when prescribed by a physician or some other healthcare provider that has prescribing authority, and are patients using these safely. And so a lot of the prevention techniques, interventions that we have used in recent years, including, again, the PDMP, have really targeted trying to decrease inappropriate use of these medications. So if we look at the number and proportion of different benzodiazepines detected among deceased persons in Florida for 2018, so this is just looking at the number of deaths that involved specific types of benzodiazepines for the latest data, which would be January through June of 2018. You can see that it's not evenly distributed among the types, and the most commonly detected benzodiazepine was alprazolam. And you can go down this list and see all of the different benzodiazepines that were detected. Some are used far less commonly, or at least they're involved in deaths far less commonly than others. So fewer deaths occurring in the first half of 2018 in Florida involved prescription benzodiazepines compared to the first half of 2017, but these declines were not observed uniformly again across the managing entity regions. Take a look at those data. So here in this particular table, we have presented the number of occurrences and percent change of alprazolam and diazepam in decedents in Florida overall, and then by managing entity region. And again, these data are specific to just that first 6 months of 2018, so the most recent data, plus 2017. I'm sorry, that title slide should have a 2017-2018 in it, so that we can look at the percent change. And alprazolam and diazepam, let's go back up a couple slides just for a second, are typically, so alprazolam was still the most commonly detected benzodiazepine in 2018. Diazepam was also in 2017. So we have two new ones that have increased in terms of their likelihood to be detected in these deaths. That's why we picked alprazolam and diazepam to put in this table. So if you'll notice, from 2017 to 2018, we did see a decrease in alprazolam and a decrease in diazepam, and it's actually a little bit bigger. So this drug was comprising a larger piece of the pie, or the largest piece of the pie in both 2017 and 2018, but even that being said, it also experienced a slightly larger decrease than did diazepam. And if you start looking at region, and I'll draw your attention first to these percent changes. So again, this is the number of deaths that involved these drugs from January through June of 2017 to January through June of 2018. And we have a modest increase here in the Big Bend area. Well, it's not Big Bend, it's the Panhandle that's served by Big Bend community-based care. So a slight increase in alprazolam, but a pretty marked increase in diazepam use there. Whereas if you look in The Broward Behavioral Health Coalition, they had significant decreases in deaths that involved alprazolam and diazepam from 2017 to 2018. If you look down here, okay, so Central Florida Behavioral Health Network, again, fairly consistent declines in both of these substances from 2017 to 2018. So almost a 10% relative change and a 9% relative change. And remember, this is relative to the previous year. Whereas if you look at the Central Florida CARES Health System, their region, a decrease in alprazolam, but an increase in diazepam. We see the opposite true in the South Florida Behavioral and Health Network. In terms of maybe in these regions, you're seeing more of a shift from one substance to the other as opposed to an overall decrease or increase. And you can see some places had a decrease in alprazolam and an increase in diazepam, and then the opposite true in other regions. And so this is information that can be useful to each of these managing entities and the care that needs to be given and the attention to maybe different substances in the different regions and figuring out what are the programs, prevention strategies, or treatment resources that are needed in these particular areas. Or maybe you can draw attention to providers who are, prescribing these particular substances or diversion of these particular substances in those specific regions. Because again, the experience for the very large state, our regions are very different on a number of different indicators, and so these changes are not similar across the region. Okay, so that reaches the end of the benzodiazepine section. So if anyone has any questions specific to that particular group of substances, I will field those now.
I believe Ken had a question regarding to stimuluses here. It says, what is the 3 causes of death with stimulus?
I'm not sure that I understand the question. So what is the substance that's most common?
I'm sorry, I misread it. I get it's what is the cause of death with stimuluses?
So they're overdose due to these particular deaths, so they're fatal poisoning. And then in terms of the actual biologic process that occurs, it's going to be different by different substances, of course. But these are actually, the cause of death is listed as a poisoning by methamphetamine or cocaine. So all of these are, and then other deaths may be the ones where they're present. They could be other causes of death, but I don't have those data in terms of what those causes are, which may be what you're asking about, Ken, in terms of for those deaths. Let's look at a graph here. Let me go up. So here's cocaine deaths. So I think perhaps you're asking about the difference between this 1,469 where cocaine was detected or present versus 844. What was the primary cause here versus these? We know it's cocaine. And the way in which the data are presented in the Florida Medical Examiners Florida Medical Examiners Commission report don't present the data in that way. So that would require going back to those data and doing a little bit more digging. I'm sorry, I don't have an answer for that question now. So Mark, I don't know if Ken's giving you some response as to whether.
Oh, yeah, I don't have any more questions coming through. Sometimes participants will send questions directly to me.
Yes. So I'm hoping, Ken, that I interpreted your question properly when I answered it in terms of thinking about what's going on in these deaths in terms of the stimulants. And some of these may be, they're polysubstance where maybe opioids was deemed to be the primary cause of death, but cocaine was present. Whereas in these, and this is true for some of them, I'm sure, but I don't have those numbers, in terms of perhaps these 844, the medical examiner that did the death investigation and is certifying the cause of death would have rated the cocaine as playing a larger role in that death, even though opioids might have been present. So for all of these deaths, they're poisonings. It's just a matter of which substance is present. Hope that helps answer that question. So if we don't have any other specific questions yet, and I know it takes some time to type them into a chat box or a question and answer box, so I'll give you the chance to do that. We'll go ahead and recap some of the major findings for each of these substances that we've talked about today. So first, alcohol, we seem to see a decline in youth and binge drinking among youth, suggesting that our prevention programs and interventions are effective. The prevalence of youth and binge drinking, however, among adults is largely unchanged. Now, the one thing that I will say, the caveat to this recap point related to alcohol, is that in the latest survey of the Florida Youth Substance Abuse, in the latest iteration of the Florida Youth Substance Abuse Survey, they did see that little uptick among middle schoolers. So that'll be a trend that's important to watch moving forward with time. So is it that the age of initiation has shifted, or is it that we have an increase in initiation? So really looking at those numbers will be important moving forward to determine if that's a new trend or just an artifact that happened this year and is not the harbinger of a new trend that we're about to see. In terms of nicotine, so combustible cigarette smoking continues to level off among youth. We didn't have a lot of new data available for vaping among youth. Again, in the Florida Youth Substance Abuse Survey, they saw some different trends versus what we observed using the NSDA data. And these are different survey methodologies that ask different aged groups of people similar kinds of questions. So it could be that the differences that we see are an artifact of the surveillance itself, or that there really are some new trends emerging, and we'll need to watch that carefully as we move forward. With regard to marijuana, not only is marijuana use among both youth and adults increasing nationally, but the rise is accelerating. And based on previous year's data, the trends in Florida are preceding the national trends. Now, again, we have a little glimpse with the Florida Youth Substance Abuse Survey data that suggests that maybe some of that increase is starting to level off, which is good news, but we still have the continued challenge of marijuana use among youth in terms of its effects on development. In terms of the last groups of substances that we looked at, so in terms of opioids, the number of deaths involving most specific opioids declined in 2018 compared to 2017. And if you'll recall, one of the learning objectives that we talked about at the very beginning of this talk was being able to differentiate between those that decreased, were involved or caused a fewer number of deaths versus those that were involved in an increased number of deaths. And all of them decreased for prescription opioids with the exception of hydromorphone, buprenorphine, and fentanyl. And again, we saw some recent decreases in heroin and recent decreases in the fentanyl analogs. Really the drug that continues to play the largest role in opioid-related deaths is the fentanyl. All right. And then stimulants. Though deaths due to both cocaine and methamphetamine have increased in number for the 4 previous years, at least in the first half of 2018, we did see a decrease in deaths attributable to and involving cocaine. We did see the number of deaths involving methamphetamine continue to rise, however. And so again, this is the 5th year in a row that we have seen this increase overall in stimulant deaths. And so that's a cause for concern in terms of thinking about, this emerging epidemic perhaps of stimulant-related death and how we need to address stimulants again in the wake of the opioid epidemic. And then with regard to benzodiazepines, both the number of deaths involving these substances, these prescription drugs, and the proportion of deaths attributed to benzodiazepines is declining in Florida, which is good news in terms of prevention strategies, looking at both educating providers, giving them tools in order to see the entire prescription history of their patient, using opioids and benzodiazepines together more judiciously, and then also educating patients and members of the community about the dangers associated with these two drugs used in combination in particular, and how to mitigate your harm associated with those. All right, so again, here are the data sources that we accessed to use to present these data today. And you can, when you get these slides, you'll be able to go and look at these particular links. The Behavioral Risk Factor Surveillance System is housed on the Centers for Disease Control and Prevention website, and they have a lot of nice prevalence systems that you can go in and put different drugs that you're interested in and different places and get a lot of data that were not presented here today but might be of interest to you in your particular county or your treatment facility, the area where it is in Florida. And again, those are national data, mostly with some state modules, but you can go there and see what specific modules are done in Florida, and you can see where substance abuse modules are done across the country, and maybe get some information related to substance use through that system. The Florida Medical Examiners Commission, again, there's a link to their site where you can get both the interim reports as well as the annual reports, and we focused on reporting data from the latest one, which is the interim report for 2018, which again covered the period of January to June of 2018. I think and then the Substance Abuse and Mental Health Services Administration, that is the federal agency, again, that administers the National Survey on Drug Use and Health. And that website also has a wealth of information that you can go and access in terms of getting additional data. I know some people had some specific questions about particular areas of substance that they had today, and this might be a good resource for you. The state-specific data are 2-year averages, and so they only come out every other year or so, but you can get the national data annually. So that's a great resource for anyone who's looking for additional data than what you might find in the annual update report or the April 2019 trend report. So I know that I've taken questions up to this, throughout the presentation after each specific substance or class of substance. Are there any remaining questions that people have? If you dig into the slides after you have them in front of you, or you think of a question this afternoon, or while you're filling out your evaluation for FADA or FADA, and you want to send me an email, I've included my email address here. It's kgurka@ufl.edu. I'd be happy to answer questions afterwards. The report, as I mentioned, is available on the FADA website, so you can go access the report through that now and look up some of the more specific data that comes from these, and there are additional tables and charts that might be in there that were not presented in the webinar today.
We'll let a beat or two pass while people enter in their questions, and then we'll run the conclusion then.
Sounds great. Thanks, Mark. I know it's always awkward to try to, when you're under the gun, typing can be more prone to typos when you're trying to get something in there pretty quickly and limited to 256 characters perhaps.
Alrighty, I don't see any questions coming in. Before I run the conclusion today, And thank you, Kelly. We really appreciate you coming in and hosting this webinar for us. I got several questions along the way, and I generally get this question is about the PowerPoint, and yes, we do post it on our training library within 30 days, so you'll be able to get it there. And then, as you guys may or may not know, WebEx can be a bit squirrely at times. So if you don't get the link today to take the evaluation, simply go to our website, fata.org, and go to today's event in the training library and just simply click the link that says take survey. And now, again, I'd like to thank Kelly, Dr. Gurka, and I'm going to run through the conclusion. Please note a couple of items of business before we conclude. When I conclude today's webinar, your browser will take you to an evaluation on FATA's new website. If you want to receive CE credits or statements of credit for this event, please complete the evaluation. You will be prompted to register or sign in to complete the evaluation. You can register as a visitor at no cost. For CEs to be reported to CE broker for FLA licensing healthcare practitioners, you must provide an accurate Florida Department of Health license prefix and number the first time you register. After you register or sign in, you will be directed onward towards the evaluation. You may consider using the same email address when you register for webinars through our WebEx link and when you set up your profile in FATA system. This helps connect your attendance and your profile. You will get a second opportunity to complete the evaluation through a follow-up email later today in about 30 minutes. The sender will be Messenger at WebEx. Evaluations will close midnight on Friday, November 22nd. We do not email statements of credit. Instead, after we verify attendance and completion of the event, a statement of credit will be generated as a journal entry within your profile. Thank you for participating in today's webinar. We'd also like to thank, especially the Florida Department of Children and Families Office of Substance Abuse and Mental Health for funding today's education. Have a great rest of your day, and please hold for the evaluation.